Check the preference card, gather supplies, equipment, instruments, and attire for the team. You'll begin with opening the back table pack. You'll check the integrity of the package and the expiration date. You'll orient the package onto the back table about in the middle. You'll start opening each flap, and then on each end you'll take your hands under the cuff, grasp, and extend the drape to cover the table fully. Next, you will open your gown. You're going to open it sterilely by opening the package, making sure that there's no perforations or watermarks. You're going to open the first flap away from you, the next flap to the left of you, the third flap to the right, and the fourth final flap towards you. Then when throwing on your sterile gloves, you want to make sure that you don't make contact with your gloves and you just open them up and throw them onto your field. When opening the basin set, you want to make sure that the integrity of the package is good. You want to break the seal and unfold the flaps like I just said prior. Then you will open the instrument set by breaking each tab on the sides, opening it away from you. There should be a chemical indicator inside the set, making sure the color has changed. And then you will check the filters, making sure there's no water or holes. You're going to open your supplies onto your sterile field. You're going to make sure that you stand a good distance away from your field, not touching anything sterile. First, you're going to open some peel packs. You're going to check the integrity of the packaging material. You're going to orient the package in both hands by grasping one edge of the peel pack in each hand. Then you're going to slowly separate the sides of the peel pack, balance the item within the package to prevent contamination. You're going to maintain that distance from your field while opening it and placing it, kind of throwing it onto your field. Wrapped packages, you're going to check the integrity of the package. You're going to orient the package in your non-dominant hand so that the first flap will be opened away from you. Break or remove the seal, grasp the tab, and open the first fold away from you with your opposite hand. Secure the flap in the hand that is holding the sterile package. Open the second fold laterally and secure it. Open the third fold laterally and secure it. Then you're going to open the fourth flap towards you and secure it. And then you're going to transfer the item onto the sterile field by tossing it gently.
Inspect cuticles, nails, hands, and arms to assure that there are no wounds or infection and that the hands are free from jewelry. Now clean under each nail, washing the cleaner off after each individual nail has been cleaned. Afterwards, discard the nail cleaner after its use. Next, obtain the scrub brush and wet it, working a lather into the bristles. Wet your hands and forearms to 2 inches above your elbow in one straight motion. Do not backtrack. You begin scrubbing by coupling all nails together and scrubbing them with the bristles. Next, you will scrub each finger on 4 planes with 10 strokes to each plane. Scrub each webbed surface as a separate plane. This is the stroke method of scrubbing, as opposed to the timed method. Scrub the hand by dividing it into 4 planes as well, using circular motions. Next, divide the forearm into an upper and lower section and scrub all 4 planes for the upper section, then the lower section. After the forearm has been scrubbed, the 2 inches above your elbow is next. It will also be scrubbed on all 4 planes. Be careful to be aware of your surroundings and the sleeve cuff of the scrubs. Touching the cuff after the hand has been cleaned renders it contaminated. The same scrub will be performed on the opposite arm again, working from the nails and fingers to the elbow. After both arms have been scrubbed, throw the scrub brush away. Next, rinse your arm from the fingertip to 2 inches above the elbow, while keeping the elbows bent to allow water to run off there. Avoid touching the faucet and sink, and keep your hands tilted upward to avoid water running back down them. Approach the sterile field and remain at least 1 foot away at all times. Pinch and lift the towel from the field without dripping on the gown, gloves, or wrapper. Hold the towel in the palm of your hand and pat dry the opposite arm. Transfer the towel to the opposite hand, using the opposite end of the towel to dry the second arm and hand. Be careful to not contaminate the towel on your scrubs or surrounding objects or people. After drying, discard the towel. Reapproach the sterile field, remaining 1 foot away. Grasp the gown without touching the gloves or wrappings and lift it away. Begin donning the gown by slipping your hands and arms into the sleeves. Slide the gown further over the arms and bend the elbows to hold the gown in place. Allow the circulator to fasten the back of the gown. Keeping hands within the cuffs, pick up the glove package and put it on a flat, sterile surface. Pick up the right-handed glove and place it with the thumb down on the right gown sleeve. Pinch the cuff on the top with the left sleeve covered hand and pinch the bottom cuff of the glove with the right sleeved hand. Rotate the cuff of the glove over the cuff of the gown and push fingers into the glove, then adjust as needed. Glove the left hand using the same method. After gloving, the circulator will assist with tying the front of the gown with spinning. The donning of the sterile gown and gloves is now complete.
Partially open and orient the mayo stand cover on the back table. Insert hands into the cuff of the mayo stand cover as directed. Slide the cover on, ensuring that items that are to remain sterile do not touch the bare mayo stand. Place towels over your mayo stand to prevent any sharp items from penetrating through your mayo cover and contaminating your mayo stand. Fold and tuck any excess material, make any final adjustments, and continue with preoperative case management duties. When organizing the back table, arrange all items from the basin set and all items that were opened onto or contained within the back table pack by placing them in their final location on the back table. Handle each item only once. When finished organizing your table, there should be plenty of room left for your instrument set. When retrieving your instrument set, request the circulator's assistance. Verify exposure to the sterilization process by observing the chemical indicator. Approach cautiously, ensuring that your hands do not touch the outside of the container. Hold the tray away from you while the circulator verifies that the container interior is dry and the filter is intact. Before organizing your instrument set, you should place a towel down on your table to prevent any of your sharp instruments from penetrating your back table, just like the mayo stand. When organizing your instrument set, all of your instruments should be organized by category. For example, all retracting instruments are placed in one area, all cutting instruments are placed in another, and so on. Our next step is to help gown and glove our surgeon. First, you will start by giving them a towel to dry their hands. While the surgeon is drying their hands, be sure to have their gown ready and open the gown so they can slide their arms in. Be sure to protect your hands from being contaminated. While the circulator is tying the gown, get the surgeon's gloves ready. Be sure to open the cuff wide so the surgeon can slide their hands in without contaminating the gloves. Then have the surgeon hand you their tag so they can spin and complete the gowning process.
Are you ready to do a count?
Yep.
Awesome. So we'll start with the sponges. We've got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 Raytex. We've got 1, 2, 3 scalpel blades, no hypos, 1 suture, and then we've also got 1 scratch pad and 1 Bovie tip.
Okay.
Awesome. Ready to do the instruments?
Yep.
Okay. So we've got 1-2 curved mosquito, 1-2 straight mosquito, 1-2 curved hemostat, 1-2 straight hemostat, 1-2 Kelly, 1-2 Alice, 1 Babcock, 1 Coker, 1 right angle, 1-2 tonsils. We've got 1 straight Mayo, 1 curved Mayo, 1 curved Metzenbaum, 1-2 needle holder, 1-2 sponge stick, and we have 1, 2, 3, 4 penetrating towel clips and 1 non-penetrating towel clip.
Okay.
We've got 1, 2, 3, 4, 5, 6 forceps. We've got 1 ribbon, 1 Richardson, 1 Deaver, 1-2 Army Navy, 1 rake. We've got a 1-2 yank however. We've got a 1-2 pull, and then we've got 1, 2, 3 scalpel blade holders.
Okay, we're good.
Awesome. On setting up your back table, now that you've got your drapes ready, your instruments counted, and your basin, your meds, everything ready to go, you need to set your Mayo up. So what you'll need to do is do the basic 6. Always start with 2 incision handles. Keep them as far from the surgeon as you can. Next, you'll need to do 2 clamps. Preferably, you should always go for Kelly's. After that, you're going to need cutting. Depending on what kind of procedure you'll do, you may want a curved Mayo or a curved Metz. In most cases, you'll do a curved Metz, and for closing, you'll want a straight Mayo. After that, you're going to need forceps. Depending on, again, on the body, you may have to have DeBakey's or 2 Hatsons. From there, you're going to need retractors, and you're going to always need Ratex at the stand. 1, 2, 3, 4, 5. And there's your basic 6. On loading a scalpel blade, always use either a curved Kelly or a needle holder. I prefer a needle holder. What you want to do is make sure the blade's facing away from you and down toward the table. Take the handle, carefully slide it in, like so. Remember, safety first, and there you go. To remove it, you'll want to simply turn it, grab it from the end, and voila. Once removed, place it into the sharps container, like so.